Welcome to the COMC Community Spotlight Show. Of course, it's presented by the great folks at Central Ozarks Medical Center, where your health is their mission. And we just happen to have a great guy from COMC with us today. It's Dr. Holland Haynie. How are you, sir?
Doing really well.
Good to have you back.
It's great to be back on. Good to see you.
We had you on a show like a year ago, something like that,
Yes,
maybe a little more than a year. So thank you for coming back. You've been promoted since then, right?
Yes,
you are now the big dog, the big cheese over there at COMC. You're the Chief Medical Officer, right?
Yes, sir.
What does that mean? What does that mean you have to do?
Well, I'm still seeing patients clinically, so I do see patients 4 days a week. I think, if anything, it's opened up my visibility into how care is delivered across the region.
Yeah.
So I have a lot more involvement in how we are seeing patients at all of our clinics, the initiatives that we're trying to target along access. Also, state-level organizations have visibility into the initiatives that we're pursuing, funding. So it really keeps me busy, but I really enjoy the clinical practice.
Does it mean you have to oversee like the other doctors at COMC and kind of run that show?
It does, yes, sir. But I don't know if oversee is the best word. I think more as a voice between our administrative team and our clinical teams, looking at the access points, looking at the initiatives that our physicians are interested in, and trying to bridge that gap.
Yeah, I mean, because that's not easy. You're talking with highly accomplished individuals, and you probably have to have some sort of an ego to be good at being a doctor, right? Because you have to be confident to do that. And so when you're overseeing that, you have to be pretty smart about doing that.
You do. It's tactful, and it's about respect.
Yeah.
I think our providers bring a lot to the table. So meeting them where they're at, understanding their needs. But I enjoy it.
That's
it's
so
a
cool.
Good position.
Takes a special ability to do that. As you mentioned, you still see patients 4 days a week, which I'm guessing you probably love, because that's why you're a doctor. You're there to help people and help heal people. And you work specifically with something called the MAT program. What is that?
So our MAT program stands for Medication Assisted Treatment Program.
Okay.
And essentially what it is outpatient recovery. So we work with individuals that are challenged with alcohol, substance abuse, that essentially don't have the option or the opportunity to go away to a rehab facility. Still want to stay in their home, still want to stay in their work environment. So we have a number of different resources, from community access individuals, we have peer counselors, we have behavioral therapists and support, and then when it's indicated, we do use medications to help people get off of alcohol. But it's a package deal, right? So it really requires the whole community that we have at COMC to help provide that service to folks.
Interesting. I'd never thought about that. What do you do if you can't go to rehab or whatever? And this is kind of the plan for that. And the way the world is today, there seems to be so much stress and everything. More people have turned to that, whether it's drugs or alcohol or whatever. So there's probably more of a need for it now.
There is. I think, in my mind, there's a huge stigma. I think a lot of folks don't pursue treatment until they hit rock bottom. And in my opinion, oftentimes it's not the individual's fault. There's so many factors in their childhood, and like you said, in society these days, folks looking for ways to manage their own anxiety, to manage their own stress, to manage their own pain. So myself and my colleagues look at it as the same way we would diabetes or any other condition, that there are factors we need to consider. Every care plan is different, and I think the biggest piece is that to remove that stigma, so folks don't come in feeling that they're being judged or that they're being looked down upon.
Right, yeah.
That's
if that stigma is keeping them from getting better and being healed, then that's standing in the way.
Absolutely.
Yeah, okay. So you guys are a federally qualified health center.
That's correct.
What does that mean?
Well, at the end of the day, it means we take all comers. I mean, we don't, whether it's self-pay, whether it's private insurance, we do a lot with Medicaid. The term goes back to the 60s. I believe President Lyndon Johnson initiated the program to fill the gaps in rural America where care wasn't being delivered like it was in the cities. The Accountable Care Act earmarked about $11 billion for federally qualified health centers. So today it's essentially about access. It's about allowing folks to get in, whether it's primary care, whether it's dental, whether it's vision, one of our new services.
Yeah.
So we fill those gaps. But from my standpoint, it's about providing folks access, so they're not having to drive an hour or two to Jeff City or Springfield or Columbia for any of the services that we offer.
You know, it's so interesting too, having lived in big cities, the medical system works differently there. Because things are closer and there's so many more people and everything. You come to like our area, which is more rural, and it works a little differently because it is rural. And it seems like COMC has kind of figured out how to deal with that, you know, because you go out into the community a lot.
Yeah, we do. Whether it's, I mean, most of our staff on some level volunteer at events. We were at the Dogfood Festival last weekend. We go to the shootout, you name it, the air show. We actually have a number of mobile medical units. We have a mobile dental unit, a mobile medical unit, and a new mobile optometry unit.
Yeah.
It does allow us to meet people where they are.
Yeah.
Absolutely.
And you cover a lot of areas. I know you do medical health care, obviously, you know, for people that aren't feeling well, but you also do behavioral health care. Right. Somebody needs somebody to talk to, you do dental. And as you just mentioned, the new eye care, optometry, that's a whole lot of service areas there.
It is. And we're super excited about the optometry. We brought on Dr. McCreary recently, and as she's seeing patients now, we have a mobile optometry unit so that we are right now seeing patients in Camdenton and Richland, and moving forward through the summer and into next year, we'll be taking the mobile optometry unit out to the schools, certainly kids that can't see, can't learn, and oftentimes being able to take time off school, parents taking time off work, you have to return to pick up the prescription. There's so much involved in that, so we're trying to bridge that gap as well.
Isn't it amazing? This is why COMC is so good, because they got people like Dr. Haynie here. So we'll continue to talk to Dr. Holland Haynie, Chief Medical Officer at COMC, when we come back on the COMC Community Spotlight Show. Getting and staying healthy has never been easier with COMC. With convenient locations throughout the lake area, including our Hy-Vee location in Osage Beach, care is always close to home. From pediatrics and OBGYN care to behavioral health, dental, primary care, and now offering optometry with our mobile unit. COMC provides high-quality health care for everyone, regardless of insurance or ability to pay. We accept Medicaid, Medicare, private insurance, and self-pay. Getting healthy is easy with COMC, where your health is our mission. Welcome back to the COMC Community Spotlight Show. We're talking with Big Cheese, one of the big cheeses over there at COMC, Dr. Holland Haynie, the Chief Medical Officer. So COMC, from what I understand, kind of assesses itself every year. So 2025, last year, what did the assessment show? What did you do for the community? Kind of
busy year. You know, I think one of the big areas we try to focus on is helping folks get access to care. And that doesn't always mean the location or same-day appointments. Oftentimes, I think it's financially driven. A lot of folks don't have or don't think they have the capacity to pay, so they wait until the wheels come off the bus.
Yeah.
We really try to help with that process. We have a lot of very talented individuals in the organization that help folks apply for Medicaid. I believe we had over 1,500 applications last year that we helped people put through. Delivering babies, there's a big need for that in the region, clearly. Don't want our moms to have to travel for OB care. So Dr. Macias and Dr. Chisholm do a remarkable job. I want to say 250-something deliveries last year alone. So just a lot of growth. I think we're very happy with where we are, but we're also trying to improve access points. We just opened a Crocker clinic about 2 weeks ago out in Crocker. So that'll be our 7th brick and mortar location here in the lake area. So.
Dang, okay. So started in Richland,
yes, sir.
Osage Beach, and you got a couple of places in Osage
2 there,
Beach.
yes, sir. We took on the Boone Health down next to Hy-Vee last year and brought them on board.
And Camdenton just expanded.
Correct.
You're in Laurie in the Laurie Terrace Mall. You're in Eldon in the elementary school, I think.
Yes, sir.
And as you mentioned, brand new in Crocker.
Correct.
What are you doing up in Crocker?
So we've been using our mobile medical unit out there for some time while while the building was being renovated and upgraded, and now we are seeing primary care patients there.
Okay.
Yes, sir. And
So,
plan to have dental services there as well.
so you're doing more than just like one thing in Crocker.
Correct.
Primary care, dental coming, optometry coming up there?
Absolutely. We're planning to have the optometry out in schools and rotating to our separate sites. And I think that goes back to your earlier comment about what are FQHCs. That's the model. Ideally, folks come in to see me for primary care. Perhaps another member of the family is able to get dental services same day. Another member of the family is able to see a behavioral health specialist. And that one-stop shopping under one roof is really the
I never thought about that. That's pretty cool. It's not just all these services you offer, but you can offer them at the same time.
Absolutely.
For a family group that comes in.
Well, gas is expensive.
Yeah.
More so than ever before now. And for a lot of folks, that's a big deal. You're driving in 45 minutes to have to make that trip multiple times. If we can decrease that burden on patients financially, that's what we try to do.
It's pretty amazing. One of the things in this job, I get to meet a lot of COMC people, which is so great. So many good people over there. You mentioned Dr. McCreary taking over the optometry, and just great dentists, of people that, usually people don't like to go to the dentist, and COMC has people that is like, hey, I'm ready to go there. It's fun to go over there.
Absolutely. And we have programs. We have our Water Waves program, which is essentially a passport book that kids come in, they get their primary care, they get a stamp, they get their dental cleaning, they get a stamp, and ultimately providing tickets to water parks regionally. We do pediatric sedation. Our Dr. Curry, our chief dental officer, brought that program on board.
Another great doctor.
She's amazing, yes, sir. So she brought that on a couple of years ago. Just, again, services we're able to offer to the community so folks aren't having to drive 2 hours. That I keep coming back to that, but that's foundational to what we're trying to offer.
And pretty important to a rural community like this is.
Yes,
we're in such a strange area because we are rural, and yet we get, millions of visitors every year. So it's just a interesting mix of the two. Speaking of that, the lake in the summer is a whole different animal, right? And you guys kind of take on the burden of trying to keep everybody healthy in the summer, whether you're a resident, whether you're a visitor. How do you do that at COMC? What's the plan for that?
I think education's key. I think talking with folks, I try to do that, whether they're folks coming in for an urgent visit or a routine visit, feeling out where they're at, what activities they're going to be involved in, trying to counsel them around things not leaving your meds in your car when it's hot. Sunscreen's huge. I talk with folks. Skin cancer is the #1 cancer in our country, very preventable. So talking with folks about sunscreen application, putting it on before you go outside, reapplying it every hour, using at least 30 SPF. So I think it boils down to education, not in a paternalistic type way, but more in a meeting people where they're at, exploring what their current understanding is and where I can potentially provide some advice.
Well, and here at the lake, every year, multiple times a year, we'll go out to eat or something and we'll see somebody lobster red because they forgot to put the sunscreen on or whatever the case might be. That's not really very healthy.
No, it's not. Statistics will show you just 5 severe sunburns like that can increase your chances of cancer.
Really?
So that's really where we try to get ahead of this and prevent those lobster type burns and talk with folks and get them to understand the gravity of the situation.
I think we've all been there though.
Absolutely.
Whether you learn the hard way the first time or you just got stupid after that and did it, again.
I think our understanding of it's come a long way too. In the 70s when I was growing up, folks would put the tanning oil on and sit out and want to get that type of cook going. So I think we now understand that your skin's sensitive and it doesn't take much to increase
I do have to say
odds.
I enjoyed the girls doing that though. I had, I'd chaperone a few times, right? So let me help you with that oil. So he's Dr. Holland Haynie, COMC. And if people want more information about all of this, you can get that at your website, which is centralozarks.org.
That is correct. And there's an access number on there for all services. And I would just encourage people, if you're not sure if you can afford care, call us. We have a route. We can help. Just would like to see folks before the wheels come off the bus.
You find a way so that they can come in.
We do, yes, sir.
Absolutely. Okay. Thank you, sir.
Absolutely.
Good to see you again.
Nice to see you. Thank you.
Dr. Holland Haynie, Chief Medical Officer at COMC. Thank you so much for joining us for this COMC Community Spotlight Show.
If you love the lake, you gotta love Lake TV.
Don't miss out on your favorite show. Watch Lake TV on demand on YouTube, Roku, and Fire TV.